Being a cardiac surgeon, I have been able to help patients enjoy their normal quality of life and get back to doing what they've always been doing. It has been an incredibly blessed, rewarding experience. But it was a real shock when one night, my wife, who's an ICU nurse, had her head on my chest, and she said, "You have a murmur." And I went and got my stethoscope, and there it was, a typical murmur of aortic stenosis. We did an echocardiogram, and it was not real severe at the time, but aortic stenosis gets worse, categorically. I knew that I would need some intervention on the valve, and in this particular case, that's going to require valve replacement. A couple years after I was diagnosed, a revolutionary new way to deal with severe aortic stenosis called TAVR was approved by the FDA. And nowadays, I do this procedure in a broad spectrum of patients. Over the years, I began to notice some differences in some of my activities. When I would climb stairs, I was getting much more short of breath. And actually, I began to notice lightheadedness, which is a very bad sign.
When I learned that Rick had severe aortic stenosis, I was quite shocked.
We had to switch from his colleagues to his heart team. We had to become non-biased and make medical decisions for him as a patient, knowing that he's also our friend.
We discussed with Rick his different options as we would anyone else. Open heart surgery, where we would open the chest with that as an extensive recovery, and then TAVR, where we go through an artery in the leg, usually go home the next day.
He was just turning 72, and he has a lot of life left. So we wanted a valve that could potentially last as long as possible.
He knew the complications, but they consisted of death, stroke, bleeding, and damage to the blood vessels.
However, I would have advised this for a patient, so I felt it was also the best thing for me.
On the day of the procedure, we were very optimistic for Dr. Dearman's results.
I was told that the procedure took under an hour. As far as recovery, I went home the next day. I went to a party 2 nights after I had the procedure done, and I was back to work on Monday, making rounds and in the operating room that week doing cases.
His recovery after TAVR was substantially shorter compared to open heart surgery.
Not every patient is a TAVR candidate, but for patients that have the option between the two, I can confidently say now that there's absolutely no comparison in the advantages that TAVR offers. Now I'm retiring. I'm moving to Eugene, Oregon. I'll be near my brand new grandbaby and my son and daughter-in-law. What I'll miss more than anything else is going to be the people. This Lafayette community has been a family, and I will miss them.
He's going to be hard to replace, but that's what we want for all our patients, is to go off and have a fruitful life, and I'm glad he's able to do that.
This is a new chapter, but I feel like I'm just getting started.